Diaphragmatic hernia. Diaphragmatic hernia is protrusion of abdominal contents into the thorax through a defect in the diaphragm. Diaphragmatic hernia usually occurs in the posterolateral portion of the diaphragm in 95% of cases and is on the left side in 85% of cases. In 2% of cases it is bilateral. The estimated incidence is 1 to 4 in 10,000 live births. Anterior hernias are far less common 5% of cases. Other congenital anomalies are present in about 50% of cases, and adrenal insufficiency is relatively common. Loops of small and large bowel, stomach, liver, and spleen may protrude into the hemithorax on the involved side. If the hernia is large and the amount of herniated abdominal contents is substantial, the lung on the affected side is hypoplastic. However, the lung on the opposite side can also be adversely affected. Signs, symptoms. Respiratory distress typically occurs in the first several hours after birth and occurs immediately after delivery in severe cases. After delivery, as the neonate cries and swallows air, the stomach and the loops of intestine quickly fill with air and rapidly enlarge, causing acute respiratory compromise as the heart and mediastinal structures are pushed to the right, with the most frequent left-sided hernia, compressing the more normal right lung. A scaphoid abdomen due to displacement of abdominal viscera into the chest is likely. Bowel sounds and an absence of breath sounds may be heard over the involved hemithorax. In less severe cases, mild respiratory difficulty develops a few hours or days later as abdominal contents progressively herniate through a smaller diaphragmatic defect. Rarely, presentation is delayed until later in childhood, sometimes after a bout of infectious enteritis, which causes sudden herniation of bowel into the chest. Diagnosis, sometimes prenatal ultrasonography, chest X-ray. Management. Surgical repair. If diaphragmatic hernia is suspected in a neonate with respiratory distress, the neonate should be immediately endotracheally intubated and ventilated in the delivery room. Surgery is required to replace the intestine in the abdomen and to close the diaphragmatic defect after the neonate's lung function, acid-base balance, and blood pressure have been optimally managed.